Insurance companies have a problem with conflict of interest. They are in business to make money, so every time they provide money for healthcare, it comes off their bottom line. Do you see this as problematic, and what is the solution?
Yes, it's problematic, and once again, it goes back to the monetary system they're using because they're able to do this. Um, they don't have to account for where their money goes or for where their profits are really coming from. They're able to double charge, triple charge, not only consumers, but the companies that build the products, that invest in and build the products that we're using nowadays, such as MRIs, the machinery, the basic X-ray machineries, any improvements made, any small patent that's made, they are controlling all of this, and they're doing it through the usury. It's not like the insurance company alone gets together and says, hey, we're going to rip off the American people. It's the usury controlled by the lobbyists, that's controlled by the Federal Reserve, that's controlled by, I don't know who. It's probably not a very good group of people.
Well, suffice to say, our healthcare costs are ridiculous because of this system that everybody benefits but the consumer. Isn't that pretty obvious?
Yes, we're paying perpetually for the usury that was used in the original loans, the original grants for the investment in designing MRI equipment, the mammogram equipment. Sorry, I'm not familiar with the terms on that. The X-rays. We're still paying for X-ray research because it's usury and it can never be repaid.
Okay, Santa, do you want to address the problem of the conflict of interest that insurance companies just automatically have?
I could address it, but I'm really in favor of the single-payer system. And as far as insurance companies go, they have a lot of staffers who are making health decisions, essentially making health decisions that are contrary to what the doctors' and patients' wishes are. And they don't really have the medical training, most of them, and they shouldn't be in a position to control somebody's health care when that patient really doesn't have a chance to talk with the staff member of the insurance company who's making these sometimes life-altering and life-and-death decisions that affect them directly as patients.
That's a good point. Harry?
Roughly a third of the cost of our healthcare system goes to insurance companies. We don't need them at all. And if we do have them, they should be government, nonprofit insurance companies. There are places where you do not want profit and the profit motive. And there's no better example of that than medicine. The last thing you want to do when you're asking or consulting with someone who's advising you on an operation or some procedure is to have them to have a vested interest in that operation or procedure. It's just blatantly stupid, and we cannot afford to be running medicine as a business, nor should we want to do that even if we could afford it. Because what we really want to do is run our medical system like they do in the Army and the Navy, where you have physicians who are paid very well with excellent benefits, but they are never rewarded, not one dime, what they advise you one way or the other, whether it's a dentist or whether it's a medical doctor or a surgeon. They have no vested interest, and that's the way it should be. That's the only system that we can afford to have in this country, and we could have that overnight if the majority of citizens were in charge of this country instead of the lobbyists that run our Congress for these health insurance companies and banks and other private corporations that are bankrupting our country.
Thank you.